Are you unknowingly compromising your kidneys with your everyday routines and habits? Some seemingly benign activities, through constant repetition, can silently harm your kidneys and put your health at risk. So, make sure you're aware of these detrimental habits. The reality is, 90% of Americans don't realize they have kidney issues until it's too late. Early kidney disease often hides behind other symptoms, leading to severe damage before any clear signs appear. By the time you notice symptoms such as swelling, brain fog, fatigue, weakness, muscle spasms and cramps, or back pain, it might be too late. Treating advanced kidney disease is more challenging and costly. It's important to understand that most kidney damage, especially chronic cases, is irreversible. If your kidneys fail, toxins accumulate in your body, leading to various health issues and significant discomfort. The worst-case scenario is kidney failure, which might require dialysis or a kidney transplant for survival. Here's a crucial insight: your lifestyle choices. Healthy daily habits can protect your kidneys, while harmful ones can damage them. You have the choice: either continue with habits that risk kidney damage or make informed decisions to safeguard your kidney health. Before making any changes, it's essential to be informed. We are here to highlight the 18 most harmful daily habits that can damage your kidneys quickly. Over the next few minutes, we'll not only identify these risky habits but also offer practical advice and solutions to maintain kidney health. Prepare yourself for some eye-opening revelations. Before we start, please note that all the information in this video has been thoroughly fact-checked, is unbiased, and reviewed by experts. Now, let's get into the 18 worst daily habits that can rapidly harm your kidneys. 18. Excessive salt consumption. A common yet often overlooked danger in your daily meals is excessive salt. Sodium chloride, better known as salt, is crucial for numerous bodily functions. However, consuming too much salt presents a serious challenge to the kidneys, which are responsible for filtering waste from your bloodstream. The problem starts with hyperfiltration, where the kidneys are forced to work harder to expel the surplus salt. In simple terms, salt molecules are heavy and harder to pass through the kidney nephrons, leading to increased glomerular pressure. This additional strain not only fatigues the kidneys but can also contribute to kidney damage and disease. Furthermore, a high intake of sodium can diminish the efficacy of certain medications designed to protect the kidneys, such as angiotensin-converting enzyme, ACE, inhibitors and calcium channel blockers. Excessive salt consumption also disrupts the fragile balance between sodium and potassium, further impairing kidney function. The World Health Organization, WHO, advises keeping sodium intake below 2 grams per day per person. Nevertheless, many Americans consume 50% more salt than this recommended limit. Processed foods like instant noodles, canned goods, and pickles are often loaded with sodium and can be detrimental to your kidneys. To promote optimal kidney health, try reducing your sodium intake and seasoning your food with herbs and spices rather than salt. For instance, use garlic powder instead of garlic salt. Additionally, make it a routine to check food labels when shopping. Fresh meats, fruits, and vegetables usually contain less sodium compared to processed options. It typically takes about 6 to 8 weeks for your taste buds to adjust to lower sodium levels, but once you do, you might find that foods you once enjoyed, like potato chips, taste overly salty. If you're finding this video useful, please give us a thumbs up, and we'll continue to create similar content. 17. Excessive sugar consumption. The shift from enjoying a sugary treat to experiencing detrimental kidney effects begins when blood sugar levels surpass 180 mg per dl. At this crucial point, your kidneys, trying to handle the excess, begin to excrete sugar into your urine. While this might appear to be a safeguard, it actually signals the onset of potential kidney damage. Elevated sugar levels in your blood can injure the tiny blood vessels in your kidneys, impairing their ability to filter properly. This damage can lead to proteinuria, where essential proteins are lost through urine. If not properly managed, proteinuria can evolve into chronic kidney disease and potentially progress to end-stage renal failure. In addition, high sugar consumption can increase blood pressure, placing extra stress on the kidneys. This added burden can hasten the development of chronic kidney disease and even lead to end-stage renal disease, ESRD. Excessive sugar intake is a significant risk factor for kidney health, as demonstrated by a study published in Frontiers in Nutrition in 2023 and covered by Harvard Health. This research tracked 28,333 adults over 11 years and found an 88% higher risk of developing kidney stones among those who got 25% or more of their daily calories from added sugars, compared to those who consumed less. This study highlights the importance of cutting back on added sugars to protect kidney health and prevent kidney stones. To reduce the health risks associated with excessive sugar, limit your intake of processed foods and sugary beverages, which often contain high amounts of added sugars. Instead, choose whole foods and natural sweeteners. A kidney-friendly diet should include a variety of fruits, vegetables, healthy fats, and lean proteins while minimizing salt, sugar, and refined carbohydrates. 16. Excessive meat consumption. Eating meat, especially red meat, results in a greater acid load during digestion compared to plant-based proteins. This increased acidity can put extra stress on the kidneys and may accelerate the onset and progression of chronic kidney disease, CKD. Over time, this could lead to kidney failure. By substituting red meat with other protein sources like fish, poultry, or plant-based options, you can significantly lower the risk of kidney damage. Plant-based proteins and lean meats such as poultry and fish are preferable because they generate less dietary acid and fewer harmful byproducts, such as advanced glycation end products and uremic toxins. A 2017 study revealed that a diet high in acid-producing red meat combined with a low intake of base-producing plant proteins like chickpeas, broccoli, or beans could lead to kidney injury. This suggests that excessive meat consumption might negatively affect kidney health, potentially leading to CKD and end-stage renal disease, ESRD, even in those without other apparent risk factors. Therefore, it's wise to replace red meat with plant-based proteins such as soy and legumes to better protect kidney health. Additionally, consuming too much meat contributes to the formation of uremic toxins in the gut, including trimethylamine N-oxide, TMAO, indoxyl sulfate, and p-cresyl sulfate. These toxins are linked to an increased risk of heart disease and can speed up kidney disease progression. Moreover, a high protein intake, particularly from animal sources, can adversely affect your kidneys by increasing blood flow and pressure within them. This can lead to glomerular hyperfiltration, which might accelerate chronic kidney disease. Dietary guidelines suggest a protein intake of 0.6 to 0.8 grams per kilogram of body weight per day for individuals with chronic kidney disease who are not on dialysis. For those on dialysis, a higher intake of 1 to 1.2 grams per kilogram of body weight per day is recommended. 15. Excessive strenuous exercise. Engaging in excessive and intense exercise can damage your kidneys in several ways. One significant risk is rhabdomyolysis, a condition where intense physical activity leads to the breakdown of muscle cells, releasing a protein called myoglobin into the bloodstream. This protein can be harmful to kidney function. Factors that elevate the risk of rhabdomyolysis include dehydration, certain muscle disorders, the use of pain relievers like nonsteroidal anti-inflammatory drugs, NSAIDs, heavy alcohol consumption, hot weather, and the intensity of your workouts. A 2022 study published in the Sports Journal examined the impact of various types of exercise on kidney health. It found that moderate intensity and consistent exercise is generally beneficial for individuals with both acute and chronic kidney conditions. Conversely, excessive and strenuous exercise, particularly when you're dehydrated and in hot weather, can lead to sudden kidney damage and exacerbate existing kidney issues, potentially resulting in kidney failure. Moreover, endurance activities can cause acute kidney injury, AKI, due to pigment nephropathy. This condition arises when myoglobin from damaged muscles and hemoglobin from damaged red blood cells constrict the blood vessels in the kidneys. This constriction can directly harm the kidney tubules, leading to tubular toxicity. Such kidney damage is more likely to occur in those who are dehydrated, experiencing rhabdomyolysis, or using NSAIDs. To prevent the adverse effects of excessive strenuous exercise and safeguard your kidney health, pay attention to your body's signals. Slow down if the exercise feels overly strenuous, if you experience muscle or joint pain, if heavy breathing makes it hard to talk, if your heart rate is elevated, or if you don't recover within an hour after exercising. Using an app to track your exercise progress and adjusting your routine as needed can also help. 14. Overuse of painkillers. Excessive use of painkillers can damage your kidneys, leading to a condition called analgesic nephropathy. This issue often arises from the long-term use of pain relievers, especially over-the-counter medications that contain acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, or naproxen. Individuals who rely on these medications for chronic problems like headaches or arthritis should be particularly cautious. Even though these drugs are readily available, they should not be used daily or consistently without guidance from a healthcare professional. Many Americans have caused kidney damage through the prolonged use of these medications. For those with chronic kidney disease or end-stage renal disease, ESRD, NSAIDs can be especially harmful. These drugs may reduce blood flow to the kidneys, impair kidney function, and potentially lead to kidney failure. Additionally, NSAIDs can raise blood pressure, which can exacerbate kidney damage in these individuals. Signs of kidney damage due to painkillers include persistent fatigue, frequent urination, blood in the urine, back pain, decreased urine output, feeling drowsy, confused, or excessively tired, experiencing numbness or reduced sensation, particularly in the legs, nausea, vomiting, and widespread swelling or bleeding. 13. Ignoring the urge to urinate. Disregarding the need to urinate, often referred to as ignoring nature's call, can lead to a variety of health problems, including kidney damage. When urine is not fully expelled from your body, it can result in a condition known as hydronephrosis, where one or both kidneys swell. If left untreated, hydronephrosis can progress to kidney failure. Continuously delaying urination also raises the risk of urinary tract infections, UTIs, because a full bladder becomes a breeding ground for bacteria. These infections can spread to the kidneys and cause damage. Furthermore, consistently holding in urine can lead to bladder overstretching, which may damage the bladder and put additional pressure on the kidneys, potentially causing kidney harm. Ignoring the urge to urinate can also result in tears in the bladder wall over time, reducing the bladder's capacity to hold urine and increasing the likelihood of UTIs. These infections can worsen into kidney infections or even sepsis. To support kidney health and manage the urge to urinate effectively, it's crucial to take regular bathroom breaks and respond to the urge without delay. If you experience discomfort, urinate promptly after waking up to start your day, and establish a consistent urination schedule. Setting reminders to take bathroom breaks every 2 to 3 hours can help alleviate pressure and prevent urgent issues. 12. Ignoring urinary tract infections. Urinary tract infections, UTIs, are bacterial infections affecting various parts of the urinary system, including the bladder, ureters, kidneys, or urethra. While most UTIs can be treated effectively with antibiotics, neglecting to address the symptoms can cause the infection to worsen. If untreated, the infection may progress to the kidneys, leading to a condition known as pyelonephritis. This serious condition can cause lasting kidney damage or even result in sepsis, a potentially life-threatening reaction to infection. The urinary system is essential for filtering waste and managing fluid balance in the body. When bacteria accumulate in the urinary tract, they can cause infections, leading to symptoms such as pain, frequent urination, a burning sensation, cloudy or bloody urine, and a constant urge to urinate. A study published in the Turkish Journal of Medical Sciences in 2014 investigated 276 individuals with bacterial infections in their urine, particularly focusing on those with chronic kidney disease. The study found that elderly patients with chronic kidney disease, especially women with kidney stones, are at higher risk for upper urinary tract infections. Therefore, if you experience symptoms like burning or pain during urination, it's crucial to seek medical help. Your doctor might also run tests if you have additional urinary or kidney issues, such as kidney stones. Persistent kidney infections can lead to severe complications like pyelonephrosis, where pus accumulates in the kidney, potentially resulting in loss of kidney function. 11. Ignoring high blood pressure. High blood pressure negatively impacts the kidneys by causing damage to the blood vessels that supply them. This damage results in the vessels becoming rigid, which decreases blood flow to the kidneys and impairs their functionality. Additionally, the tiny blood vessels inside the kidneys that are crucial for filtering blood may also be affected. The link between high blood pressure and kidney damage is significant, as it affects the nephrons, the microscopic units in the kidneys responsible for filtering blood. When the blood vessels supplying the nephrons are damaged, they do not receive sufficient oxygen and nutrients, which exacerbates kidney damage. This creates a vicious cycle where kidney impairment makes it more difficult to control blood pressure, potentially leading to kidney failure. A study published in the American College of Physicians Journal in 2005 examined the effects of high blood pressure on kidney disease across various ethnic groups. The study, which involved 1,172 participants, revealed that those with lower blood pressure had a 32% reduced risk of kidney failure compared to those with typical blood pressure. Additionally, the risk of kidney failure or death was 23% lower in the low blood pressure group. This research highlights the critical need to identify and manage high blood pressure early to prevent kidney disease. Preventing kidney damage from high blood pressure involves long-term management strategies. Key lifestyle changes, such as increasing physical activity, maintaining a healthy weight, quitting smoking, managing stress, and reducing salt intake, are essential for lowering blood pressure. These modifications can significantly decrease the risk of kidney damage. Furthermore, medications specifically designed to lower blood pressure, such as angiotensin-converting enzyme, ACE, inhibitors and angiotensin receptor blockers, ARBs, are crucial in slowing the progression of kidney disease associated with high blood pressure. 10. Poorly managed diabetes. Elevated blood sugar levels associated with diabetes can inflict damage on the blood vessels and nephrons in the kidneys, the minute structures that filter blood. This damage can deteriorate kidney function, potentially leading to chronic kidney disease, CKD. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, identifies diabetes as the primary cause of kidney disease, with approximately one-third of adults with diabetes developing kidney issues. The National Kidney Foundation, NKF, highlights diabetes as a major risk factor for CKD. Consequently, individuals with diabetes are at an increased risk of kidney disease the longer they have diabetes. This relationship emphasizes the need for effective diabetes management to prevent diabetic kidney disease, DKD, which can advance to end-stage renal disease, ESRD, if not properly addressed. Moreover, high blood pressure, a frequent complication of diabetes, can exacerbate kidney damage by affecting the blood vessels necessary for filtration and regulation, as noted previously. Thus, managing diabetes efficiently requires controlling not only blood sugar levels but also blood pressure and cholesterol. This holistic approach should involve a healthy diet, consistent exercise, adherence to prescribed medications, and regular medical assessments to monitor kidney health. 9. Skipping regular exercise. Engaging in regular exercise provides a wealth of benefits for individuals with kidney disease, including better control of blood pressure, improved sleep quality, enhanced physical strength, and reduced anxiety and depression. Conversely, neglecting regular exercise can deprive you of these advantages and potentially worsen kidney function. It's important to remember that while exercise is advantageous, intense workouts, particularly in hot conditions, can lead to dehydration and exacerbate kidney issues. Therefore, moderation and appropriate exercise routines are crucial for those with kidney concerns. Studies consistently show that a lack of physical activity can result in diminished strength and exercise capacity, a common issue in patients with chronic kidney disease, CKD. A 2011 Cochrane review examined the impact of exercise training on adults with CKD. The review, which included 45 studies with 1,863 participants, revealed that regular exercise enhances fitness, boosts aerobic capacity, and increases the body's ability to utilize oxygen by about 56%. Additionally, exercise lowers blood pressure and heart rate while improving quality of life. These results underscore the importance of adopting a more active lifestyle to support kidney health. To break the habit of skipping exercise and promote kidney health, aim to engage in at least 30 minutes of moderate activity each week, such as running, cycling, walking, or dancing. If you're new to exercising or have kidney issues, begin with gentle movements and gradually increase the intensity to prevent injury. Short, frequent sessions are often more effective than longer, sporadic workouts. To stay motivated and track your progress, use a journal or a fitness app to set goals and monitor your achievements. Reward yourself with non-food incentives to maintain enthusiasm. Choose activities you enjoy, like gardening, raking leaves, or seasonal fruit picking. Exercising with friends, family, or colleagues can offer additional encouragement and support. You might even start a walking group at work or plan regular walks with a friend to make fitness a fun, social activity. 8. Drinking sodas. You may already know that sodas aren't the healthiest choice, but do you fully understand the extent of their impact on your kidneys? Consuming sodas, especially colas, can significantly increase the risk of chronic kidney disease, CKD, due to their high content of sugar and phosphoric acid. The large amounts of sugar in sodas can lead to obesity, diabetes, and cardiovascular issues, all of which are known risk factors for CKD. Additionally, the phosphoric acid in cola drinks can alter urinary conditions, making kidney stones more likely, which further exacerbates the risk of CKD. A 2014 study published in Nephrology Dialysis Transplantation reviewed 17 different studies to investigate the relationship between soda consumption and CKD. The research found that regular consumption of sugar-sweetened sodas was associated with a 58% higher risk of developing CKD. Even those who consumed artificially sweetened sodas regularly faced a 33% increased risk of CKD compared to those who did not drink them. To reduce the risk of CKD, consider cutting back on soda and opting for healthier beverage alternatives like water, unsweetened tea, or low-fat milk. 7. Eating processed foods. Incorporating processed foods into your diet, especially ultra-processed foods, UPFs, can severely impact kidney health. UPFs are industrially manufactured items that often contain excessive amounts of artificial additives, added sugars, refined carbohydrates, unhealthy trans fats, and high levels of salt. These ingredients enhance the flavor and appeal of processed foods, which can lead to overeating. However, these foods are usually lacking in essential nutrients like fiber and vital micronutrients. They may also harbor contaminants from their packaging. Studies reveal that consuming a large quantity of UPFs can be harmful to kidney function. Research published in the American Journal of Kidney Diseases found that individuals with chronic kidney disease, CKD, who ate more UPFs experienced worsened health conditions and higher mortality rates. This underscores the importance of making thoughtful dietary choices for maintaining kidney health. To protect your kidneys, it's wise to cut back on UPFs. To improve kidney function and minimize the negative effects of processed foods, ensure you drink plenty of water to help flush out sodium and toxins and prevent kidney stones. Embrace a diet rich in fruits, vegetables, lean proteins, and whole grains to support healthy kidneys and reduce the risk of conditions like high blood pressure and diabetes. 6. Sitting for too long. The correlation between prolonged sitting and kidney disease is significant, even when adjusting for variables such as age, gender, smoking habits, and physical activity levels. Research indicates that those who minimize their sitting time have a reduced risk of developing chronic kidney disease, CKD, regardless of their typical exercise routines or body weight. A 2022 study featured in the Sports Medicine Journal examined data from 455,056 individuals over 21 years. This study revealed that extended periods of sitting at work were associated with a 26% increased risk of CKD, a 19% greater chance of requiring dialysis, and a 43% higher risk of mortality related to kidney issues. Incorporating even brief bouts of exercise, such as 15 minutes a day, was shown to lower these risks. Thus, reducing prolonged sitting is vital for maintaining kidney health. A useful tip to stay active even while seated is to keep a small water bottle on your desk. Not only will it help keep you hydrated, but once it's empty, it will remind you to get up and refill it, giving you a break from sitting. This simple habit offers dual benefits for your kidneys.
5. Not drinking enough water. Failing to drink enough water can result in dehydration, a condition where the body loses more fluids than it takes in, causing an imbalance of crucial electrolytes like potassium, phosphate, and sodium. These electrolytes are vital for transmitting electrical signals between cells. If these levels are disrupted due to insufficient kidney function, it can lead to severe health issues such as seizures, involuntary muscle movements, and loss of consciousness. Extreme dehydration can even cause kidney failure, which poses a serious risk to life and can result in anemia, damage to the central nervous system, heart failure, and a weakened immune system. Moreover, dehydration can increase the likelihood of kidney stones, complicate urinary tract infections, UTIs, and heighten the risk of chronic kidney disease, CKD. Therefore, maintaining proper hydration is essential for keeping your body's water levels balanced daily to prevent significant water deficits. Adequate fluid intake helps your kidneys eliminate waste effectively. However, drinking excessive amounts of water can be dangerous, especially for individuals with kidney issues. When kidneys are not functioning properly, waste accumulates, and too much fluid can dilute important electrolytes, leading to symptoms such as nausea, vomiting, headaches, fatigue, confusion, low blood pressure, muscle weakness, twitching or cramps, restlessness, irritability, seizures, and potentially coma. 4. Dehydration. The kidneys play a vital role in managing the body's fluid balance and filter over 200 liters of fluid daily. Their ability to regulate water is significantly influenced by hormones like arginine vasopressin, AP, and components of the renin-angiotensin system. Elevated levels of AP lead to increased water reabsorption by the kidneys, which can add to their workload. Drinking ample water can reduce AP levels, potentially lessening the burden on your kidneys and supporting their optimal function. However, researchers are still investigating whether increasing urine production to safeguard kidney filtration, especially in individuals with chronic kidney disease (CKD), is beneficial. The findings from various studies have been inconclusive. To ensure proper hydration and support your kidney health, monitor the color of your urine. It should be a straw color or lighter, as darker urine often signals dehydration. Additionally, reduce consumption of caffeinated, sugary, and alcoholic drinks, as these require more water to eliminate their toxins and chemicals. 3. Smoking. Smoking negatively impacts your kidneys in both immediate and long-term ways. Short-term effects include elevated blood pressure and heart rate due to nervous system stimulation. Over time, smoking damages the cells that line your blood vessels, known as endothelial cells. Even exposure to secondhand smoke or passive smoking has been associated with increased enzyme activity in the kidneys, which can disrupt normal blood flow and result in kidney damage over time. Chronic smoking can also decrease blood flow to the kidneys, leading to conditions such as peripheral arterial disease and arteriosclerosis, which affect the renal arteries. For individuals with chronic kidney disease (CKD), smoking heightens the risks of heart disease, high blood pressure, and diabetes, conditions that can speed up CKD progression and potentially result in kidney failure. Research published in the American Journal of Nephrology in 2007 identified a link between smoking and CKD progression in 11 of 12 reviewed studies, especially noting that smoking more than 15 packs annually greatly increases CKD risk. Additionally, smoking has been shown to affect kidney function even in healthy people, increasing the risk of proteinuria, which is an excess of protein in the urine, particularly in those with high blood pressure and high blood sugar levels. 2. Not getting enough sleep. Inadequate sleep can significantly impact your health, particularly kidney function. Insufficient sleep has been associated with more rapid declines in kidney performance and quicker progression of chronic kidney disease (CKD). This is because sleep plays a crucial role in regulating kidney function and maintaining the balance of bodily fluids and electrolytes. Additionally, sleep influences hormones involved in kidney function, such as the renin-angiotensin-aldosterone system (RAS). The RAS is essential for managing blood pressure and fluid balance. Disruptions in sleep can overstimulate this system, leading to elevated blood pressure and added stress on the kidneys. Furthermore, insufficient sleep can result in abnormal blood pressure patterns at night. Typically, blood pressure decreases during sleep, allowing the cardiovascular system and kidneys to rest. Poor sleep, however, can prevent this dip, increasing nighttime blood pressure and posing a risk for CKD progression. Chronic sleep deprivation also boosts inflammatory cytokines and activates inflammatory pathways, which can directly damage the kidneys and worsen existing kidney issues. Create a restful sleep environment by keeping your bedroom cool, dark, and quiet. Maintain a regular sleep schedule by going to bed and waking up at the same time each day, even on weekends. Engaging in regular physical activity and spending time outdoors can also enhance your sleep quality and help you fall asleep more easily. 1. Excessive alcohol consumption. According to the National Kidney Foundation, drinking excessive amounts of alcohol significantly raises the risk of developing kidney disease. Alcohol can harm the kidneys because it overwhelms the body's ability to filter out toxins efficiently, and it often leads to elevated blood pressure, a major factor in kidney damage. Furthermore, alcohol-induced dehydration disrupts how the kidneys manage fluids and electrolytes. Chronic liver damage from heavy drinking can also adversely affect kidney function by reducing blood flow to the kidneys and increasing their workload. Additionally, binge drinking can lead to acute kidney injury due to rapid increases in blood alcohol levels. A 2019 study published in the journal Nutrients explored the link between alcohol use and chronic kidney disease. Researchers tracked 45,200 adults for 8.5 years and discovered that heavy alcohol consumption raises the risk of CKD by 15%. It's important for individuals, particularly those with pre-existing medical conditions or who are on specific medications, to either abstain from alcohol or consume it in moderation. Excessive drinking can lead to high blood pressure, which is harmful to kidney health. Warning signs of kidney diseases. Recognizing the warning signs of kidney disease is crucial, especially when the condition becomes advanced. Here are some symptoms that might indicate serious kidney problems. 1. Swelling in hands and feet. When the kidneys fail to balance fluids properly, it can lead to swelling in the hands and feet due to fluid retention. 2. Fatigue and weakness. The hormone erythropoietin, EPO, is important for producing red blood cells and maintaining energy. Kidney disease can decrease EPO levels, resulting in anemia, which causes persistent tiredness and weakness. 3. Muscle twitches and cramps. Kidney function issues can lead to imbalances in electrolytes, which may cause muscle twitches and cramps. 4. Cognitive impairment. Toxin accumulation in the blood due to reduced kidney function can lead to cognitive issues such as mental fog and difficulty concentrating. 5. Back pain. Although often overlooked, back pain can signal kidney problems, whether from damage or the presence of kidney stones. 6. Increased urination. Frequent urination can be a sign that your kidneys are struggling to remove waste, indicating potential distress. Identifying these symptoms early is vital to managing and potentially improving kidney health. The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, stresses the importance of regular kidney testing, particularly for those with diabetes, high blood pressure, heart disease, or a family history of kidney failure. Early diagnosis can help slow or stop the progression of kidney disease. If this video was helpful to you, please like, share, and subscribe to our channel. Stay informed and stay healthy.